Welcome to my YouTube channel that is smooth like a floss slab. So here we are with another lecture on adrenal insufficiency. Adrenal insufficiency is also called corticosteroid insufficiency or adenocorticosinsufficiency. So the subtopics that we are going to study in um, this umbrella term are what is adrenal insufficiency, how are they released, like the or hormones that causes adrenal insufficiency if they aren't released. So those hormones, how are they released, what is the effect of it during dental extraction, how gonna you diagnose it, or what are its signs and symptoms, what is the effect of long-term exogenous steroid side effects, what are they if a person is taking exogenous steroid from a long time for a long time, and what is the treatment of it. So moving on, uh, disease of adrenal cortex may cause adrenal insufficiency. This is also called as adrenocorticoid insufficiency or corticosteroid insufficiency. So the question that arises with this uh, explanation is that what is adrenal cortex and what happens if it doesn't work. So kidney has three parts: cortex, medulla, and pelvis. Medulla makes your adrenaline, and pelvis collects your urine. Hence, cortex releases three hormones that are glucocorticoid, mineralocorticoid, and hormonal. Your glucocorticoid has a subhormone that is also called one of the subhormones that is called cortisol. This cortisol is also called stress-releasing hormone, and your mineral corticoid helps to maintain your water and salt ratio to control up your BP. This moving back to glucocorticoid and cortisol, what it does is when your body is under stress, okay, when your body gets under stress, your hypothalamus is stimulated. This hypothalamus, when stimulated, releases corticotropin releasing hormones, ठीक है, CRH, corticotropin releasing hormones, CRH. These CRH in turn stimulates the anterior lobe of pituitary gland to release ACTH. This ACTH, all of this happens when your body is under stress like any kind of stress. It can be your exams, your mental stress, or sugar, the person can have diabetes or infection or any disease, any kind of stress. Okay, in any kind of stress, your hypothalamus is stimulated, which releases CRH. This CRH in turn stimulate the anterior lobe of pituitary gland to release ACTH. This ACTH at the end stimulates the adrenal cortex to release cortisol. This cortisol raises glucose level and decreases BP, hence have negative effect on the body so that it can cope up with your stress and can work out that stress, like helps your body to work that stress out. Fine. So if your adrenal cortex isn't working, okay, what will happen, that cortisol won't be released, your body will be in continuous stress and you can collapse. So dental extraction during dental extraction, what happens is your body is under stress, thus stimulates the glucocorticoid to release the cortisol from the adrenal cortex. This decreases your BP, and thus the patient collapses. So if this happens and patient collapse on your chair, you should stop the procedure immediately. The things you have to do is to stop the procedure immediately, elevate the legs to 10 degree, that is anti-Trendelenburg position. If he or she doesn't come back within a minute, you can administer IM glucocorticoid, okay, for it, so that patient can get back into his senses. So this is what you have to do when this happens in your chair. But if you get to know that the patient is on corticosteroids or have been taking corticosteroids in the past, so what you can do is, If the patient is currently on corticosteroids, you should use your anxiety reduction protocol. These anxiety reduction protocol you must use with anyone that comes up to your dental clinic. You should use these anxiety reduction protocols with them, no matter he has adrenal crisis or not. You should use them, even if it's an all normal patient without any other comorbid. You should use them. So you should use your anxiety reduction protocols, monitor the pulse and BP of the patient during, after, and before the procedures. And you should ask him to take a steroid protocol or a steroid cover. What is a steroid cover? It is that you ask the patient or you instruct the patient to double the usual dose that he takes on the day of surgery, one day before surgery, and on the day after surgery, a day after surgery. Okay, so 3 days he have to take double dose of the corticosteroids. What are those 3 days? One day before surgery, on the day of the surgery, and a day after surgery. Okay, on the second post-surgical day that surgery has done, and it's a second day, you can ask him to go back to his normal dose. This is what you have to do with a person who is currently on corticosteroids. Okay, so if a patient who has taken 20 milligram of corticosteroids of cortisol within 2 weeks, but for in last year. Okay, what I'm saying is a person who has taken 20 milligram of hydrocortisone more than a 2 weeks, but last year, not this year. He's not currently on it. It has been in past, done in past year. Okay, you can use the anxiety reduction protocol, same as use monitor pulse and BP of the patient. This patient should be asked to take in steroid protocol, and for the patient who was taking currently steroids, we just ask him to abruptly like uh, go on your normal dose on the second day of surgery, or post surgical on the second post surgical day. But this patient, you decrease the dose gradually, like on the second post surgical day the dose should be dropped to 40 milligram, and then drop to 20 milligram on the third and the day after, 3 days thereafter. Okay, like this you have to decrease the doses gradually for such patients. So symptoms of adrenal classes are hypotension, hypoglycemia. Hypotension is because cortisol decreases your BP, hypoglycemia, and hair loss, back pain, fatigue, confusion, psychosis, fever, loss of consciousness, vomiting, and joint pain. What are the effects of long-term steroid intake exogenously? That adrenal suppression can take place, poor wound healing will be found in such patient, hypertension, Cushing syndrome, osteoporosis, osteomyelitis. Cushing syndrome, this is a patient, like this is a picture of a person who is showing up Cushing syndrome. Okay, osteomyelitis, diabetes mellitus, amenorrhea, depression and swings, mood swings, psychosis, and all this. All of this will be found in a person who is taking for a long time exogenous steroid. What is the diagnosis? You can go for a synectin test for such patients to diagnose them up. And treatment is you can ask them to have one intramuscular hydrocortisone of 100 mg, or you can even ask them to have intramuscular methylpentazolone of 150 milligram or 550 milligram, whatever that is available. So this is the end of our this topic, that this is what you need to remember for your adrenal crisis if it comes in your dental exams or something else. So yep, that's all. So do subscribe my channel and hit the bell icon right now. Subscribe and like right now, and hit the bell icon to know for upcoming videos, and also follow me on my Instagram page, that is also smooth like a floss. Thank you.